They could not believe that they didn't have to pay any money. Because the Northeast, there was a lot of unemployment straight after the war, and we were still in rationing then. And they could not believe that if they had something wrong, they could actually go to the hospital or the doctor and they wouldn't have to pay any money. You know, a home delivery, if it was the 4th of July, was 1 and 6pence. But if it was born on the 5th, it wasn't anything. And that 1 and 6pence after the war bought a loaf of bread to feed the rest of the family and a tub of margarine. That's the reality of what we take for granted now.
When I went to outpatients, I noticed how desperately poor the people were after the war. They were really, really poor, and they could not afford the health insurance they had. I know it was only a penny a week, but even that was hard. So therefore we were handed these little infants, or these infants that were well advanced in their bronchitis or their pneumonia. The difference being that the parents were more relaxed. They didn't have to pay. So they bought their children and their families when they were just starting their problems.
I think after NHS came in, we did things were happening all the time. I mean, when I first went in, there wasn't a drug to, lower blood pressure at all. So it really was nursing, the best you could do in your nursing. And I think that was a great difference once the NHS came in.
England sent this quota to Grenada asking for nurses to come in to help them out in their workforce in the NHS, in the nursing. So I took the advantage of that. I applied. I was interviewed in my country in Grenada. I passed my interview. Papers came up to England, and England accepted me and wrote back to me and tell me they will have me in October when my training will start. Hence my presence in England from 1966. And I never regretted it. I love the profession. I really enjoyed it. And I didn't want to retire.
It's still a wonderful profession for people to come into and get such satisfaction from being there, for doing what they do to me, and what I've seen them doing during my career. I mean, the improvements that have gone along in this, the possibility of being part of those improvements is such a challenge and a wonderful aspiration for people. To my mind, a wonderful organisation. The best job in the world.